Uterine cancer, often referred to as endometrial cancer or womb cancer, is one of the most common cancers affecting the female reproductive system. It occurs when abnormal cells begin to grow uncontrollably in the uterus, the organ where a baby develops during pregnancy. This disease can impact women of all ages. Though it is more common after menopause, early detection and treatment can greatly improve outcomes, which is why knowing the signs and understanding your risk is so important. What is uterine cancer? Uterine cancer generally falls into two main categories. Endometrial cancer. This is by far the most common form. It starts in the endometrium, the inner lining of the uterus. The most frequent subtype is endometrioid adenocarcinoma, which begins in the glandular cells that produce mucus and other fluids. Endometrial cancer often grows slowly and is usually detected early due to noticeable symptoms like abnormal bleeding uterine sarcoma. A much rarer and more aggressive type uterine sarcoma forms in the muscular wall of the uterus called the myometrium because it tends to progress quickly and doesn't always present early symptoms. It's often diagnosed at a more advanced stage. Signs and symptoms to watch for. One of the advantages of uterine cancer, if it can be called that, is that it often produces early warning signs. Knowing what to look for can lead to faster diagnosis and better treatment outcomes. Abnormal vaginal bleeding. This is the most common symptom. It could mean bleeding between periods, unusually heavy periods, or any bleeding after menopause. Pelvic pain or pressure, persistent discomfort or pain in the lower abdomen can be a sign. Changes in menstrual cycle, irregular periods, or spotting between cycles should not be ignored if you're experiencing any of these symptoms, especially if you postmenopausal. It's important to talk to your doctor promptly. What causes uterine cancer? There's no single cause, but researchers have identified several factors that can increase your risk. Understanding these can help with early screening and prevention. High estrogen levels. Estrogen stimulates the growth of the endometrial lining. Conditions that raise estrogen levels without enough progesterone to balance them, such as obesity, polycystic ovary syndrome (PCOS), or estrogen-only hormone replacement therapy can increase risk. Obesity. Fat tissue can produce extra estrogen, which can disrupt hormonal balance and increase cancer risk. Family history. If you have close relatives who have had uterine or colon cancer, especially if they had Lynch syndrome, your risk may be higher. Medical conditions. Diabetes, PCOS, and hypertension have all been linked to a higher likelihood of developing uterine cancer. Age. Most cases occur in women over 50, but it can also affect younger women, particularly those with risk factors. How uterine cancer is diagnosed early. An accurate diagnosis is key to effective treatment. Steps. Doctors take pelvic exam. A physical examination of the reproductive organs helps doctors look for any abnormalities. Imaging tests. Ultrasound is often the first imaging test used to view the uterus and endometrium. In some cases, MRI or CT scans may be used for more detailed images. Endometrial biopsy. This is the definitive way to diagnose uterine cancer. A small sample of the uterine lining is taken and examined under a microscope for cancerous cells. If cancer is confirmed, additional tests may be done to determine the stage of the disease and whether it has spread. Treatment options for uterine cancer. Uterine cancer is highly treatable, especially when caught early. Treatment plans are personalized based on the type and stage of the cancer as well as the patient's age, health, and preferences. Here's a breakdown of the most common approaches. Surgery. Surgical removal of the uterus, known as a hysterectomy, is often the first line of treatment in many cases. The ovaries are also removed, a procedure called salpingo-oophorectomy, to reduce the risk of cancer spread or recurrence. If the cancer has spread beyond the uterus, lymph nodes or other surrounding tissues may also be removed. And examined radiation therapy. Radiation uses high-energy rays to kill cancer cells. It may be used after surgery to destroy any remaining cancer cells before surgery to shrink a tumor as a primary treatment for patients who are not candidates for surgery. There are two main types: external beam radiation and internal radiation brachytherapy, and sometimes they're used together. Hormone therapy. Since some uterine cancers are hormone sensitive, hormone-blocking medications can help slow the growth of the tumor. These are especially useful for women who cannot undergo surgery or wish to preserve fertility in certain cases. Common drugs include progestin, tamoxifen, and aromatase inhibitors. Chemotherapy. Chemotherapy uses powerful drugs to destroy fast-growing cancer. Used for more aggressive or advanced cancers, or if the cancer returns after initial treatment, these drugs are usually given intravenously and may be combined with other therapies. Immunotherapy. An exciting and evolving area of treatment. Immunotherapy boosts the body's immune system to help it recognize and fight cancer cells while still being researched for uterine cancer. Some newer drugs have shown promising results, especially for advanced or recurrent cases. The importance of follow-up care, even after successful treatment. Regular follow-up visits are crucial. These help detect any signs of recurrence early and allow your healthcare team to monitor your recovery. You may also receive guidance on managing side effects, maintaining a healthy weight, and making lifestyle changes to lower your risk of recurrence. Final thoughts. Uterine cancer may sound alarming, but with early detection and the right treatment, it is often highly curable. Advances in medicine, from less invasive surgical options to promising new therapies, are continually improving outcomes. If you experience any unusual symptoms, don't wait. Speak with a healthcare provider on +200 and 54 7011 68 779. Call or WhatsApp. Your health is worth it. At the Center of Gynecological Illnesses, we're committed to providing compassionate expert care using the latest in medical advancements. Whether you need a diagnosis, second opinion, or ongoing treatment, we're here to help you every step of the way.